everyone! Welcome to my channel! For now, we will answer again NLE or NCLEX questions, which I think is very helpful for you. So watch till the end, cause we're gonna talk about nursing leadership and management. And let's go! Question number 1. The RN must delegate aspect of care for an assigned client to a UAP for the shift. Which client would be best to delegate to the UAP? You can pause this video while thinking of an answer because this will be a non-stop video to save time. So for number 1 question, this talks about delegation for the UAP. So the client receiving enteral feedings and is immobilized represents a more complex client who is better assigned to a licensed nurse than a UAP. That's why letter B is eliminated. And also, the client with a leaking ostomy would benefit from problem-solving innovation and is best cared by the RN, not the UAP. So letter C is eliminated.
Oh no!
Among the two, the client who recently lost her husband would benefit from professional communication with the RN and requires a high level of client interaction. So it must not be assigned to a UAP.
Oh, come on!
So the correct answer is letter D. We must know that factors to consider when delegating care include complexity of task, problem-solving innovation required, unpredictability, and level of client interaction. The ambulatory client is best to delegate because the client is likely to be stable with a low level of unpredictability. So letter D is the final answer. For the next question, which task would not be appropriate for the registered nurse to delegate to a licensed practical nurse or unlicensed assistant? By looking at this question, we can eliminate letter D because LPN or LVN can change addressing. And also, assistive personnel might perform simple nursing interventions, but the RN remains responsible for analyzing the data and the client outcome. So assigning a UAP to complete vital signs and document and report changes to the RN is eliminated. So you are left with the 2. The one to eliminate is letter A. Because LPN or LVN can reinforce teaching previously performed by RN. That's why the answer is letter C. The decision to delegate should be consistent with the nursing process. That is the appropriate assessment, planning, implementation, and evaluation. The person responsible for client assessment, diagnosis, care planning, and evaluation is the registered nurse. So for the next question, the charge nurse on the night shift reports that narcotic count is incorrect. The nurse has spoken to the responsible staff nurse and believes the substance abuse by the nurse is the cause. If substance abuse proves to be the cause of the incorrect count, what is the most appropriate next step? So by looking at the question, the best one to eliminate first is letter B. The American Nurses Association, though the Code of Ethics for Nurses, provide guidance to nurses and protection for clients and the families, but does not have the authority to discipline the nurses. So letter B is eliminated. If the staff nurse is found to be using a controlled substance, the finding must be reported to the State Board of Nursing. Individual State Board of Nursing identify the legal boundaries of nursing practice, include disciplinary action through Nurse Practice Act. That's why letter D is eliminated. An incident report must be completed because of the inaccurate narcotic count. Narcotics are controlled substances and fall under federal law and regulation. Both the pharmacy and nursing administration must be notified. That's why among the two choices, the correct answer is letter C, completing an incident report. So let's proceed to number 4. A quarterly audit is now due to evaluate implementation of an electronic medical record system on the nursing unit. As the unit representative who supervised the adaptation of this documentation system, how can the nurse best determine if nursing staff have accepted this change?
Duh.
So the question talks about change. And among the choices, letter B is incorrect because nurses who manually write nurses' notes have not accepted the change. And also, sporadic use does not indicate full acceptance of the change. That's why letter C is eliminated. And among the two, letter D, that staff likes the system is a positive indicator. It is not the same as use of the system, which is a better indicator of acceptance. So compared to both of them, letter A is the correct answer. Because when people accept change, they integrate into their daily routines and the change is maintained. So let's proceed to number 5. The nurse on the hospital quality improvement team has been asked to evaluate nursing care on the nurses assigned unit. After deciding to ask the nursing staff for assistance in this effort, what would be most appropriate for the nurse to initially ask the staff to do? So just by looking at the question below, the first one to eliminate is letter A. Because tracking the number of supplies used by client on the unit provide useful information for preparing a budget or unit staffing requirements. Same as letter B and D. Letter B and letter D also provide useful information for preparing a budget or unit staffing requirements. So the correct answer is letter C. Client satisfaction surveys are an important tool to monitor and evaluate client and family needs. This information helps healthcare organizations meet those needs. Let's proceed to number 6. An RN is about to make first round after receiving an intershift report at 3 p.m. In what order should RN see the following clients? Place the option in order. All options must be used. This question requires time just to arrange these choices, but priority setting can be implemented using a variety of models. So the first one to prioritize is letter C. The client who is post-operative should be seen first because the client is newly arrived on the unit and is at greatest risk of becoming unstable or experiencing a change in a clinical condition. Next to prioritize is letter E. The client with pneumonia. This should be seen next because the infection involves the airway. Although oxygen saturation level are higher than the critical value of 90% or less. The next one to prioritize is letter A. The client who is 4 hours post-cardiac catheterization should be seen next to evaluate the site and conduct general assessment of the affected extremity. The client who will be discharged should be seen next to determine that there will be no last-minute needs or issues. And the client who needs teaching should be seen last because this is not a physiological need. So the final answer is arranged as follows. Letter C, letter E, letter A, letter D, and letter B. Now for the next question. A client is experiencing respiratory distress. Respirations are 32 breaths per minute and shallow. The client is positioned in an orthopneic position with a heart rate of 118 per minute and a blood pressure of 90/40 mm mercury. The client is pale and confused. Which task should the nurse delegate to the charge nurse? Given the question below, it talks about delegation to the charge nurse. But then we must also put in our mind that the assigned nurse knows more about the patient. The nurse assigned to the client knows more about the client than other nurses on the unit do and can determine a change in the client's status. That is why head-to-toe assessment must not be delegated to the charge nurse. The application of oxygen is a task for the nurse assigned to the client. Given the information provided in a scenario, the nurse should apply the oxygen immediately to rectify low oxygen levels. So letter C is eliminated. And for letter D, the unit secretary could page the respiratory therapist to the room staff for assistance. That's why letter D is also eliminated. That is why letter B is the final answer. The charge nurse should be used to complete a task within the RN scope of practice, such as starting an intravenous line while leaving client assessment to the assigned nurse. Now for number 8 question. A nurse is assisting a client in room 1 with lunch. The charge nurse calls the nurse and states the client in room 3 is reporting pain and requests pain medication. What is the nurse's best and first action? So in this question, it talks about how to handle a situation. The client in pain is experiencing discomfort that should be addressed immediately. While medicating the client is important, the charge nurse is busy overseeing the functions in the unit. So, you cannot delegate this work to a charge nurse. So, letter C is eliminated. The task of feeding the client in room 1 can be delegated, but it should be delegated to an appropriate person such as a nursing assistant. So, letter D is eliminated. Compared to the two, the correct answer is letter B. Because while eating is priority, it does not take precedence over an individual with pain. The client in pain is experiencing discomfort that should be addressed immediately. That's why the nurse should stop feeding the client in room 1 and medicate the client in room 3 as the priority action. Now for number 9 question. After receiving the intershift report, the registered nurse has many tasks to complete during the next 12 hours. Which task should the nurse delegate to an unlicensed assistant? Select all that apply.
Oh no!
So the question talks again about delegation. So we must have already the knowledge about delegation, so it will be easier for us to answer this kind of questions. So by looking at the choices, the client with an infected wound should have the dressing changed by the RN for assessment of effectiveness of wound therapy and complications. So letter D is eliminated. Let's also eliminate letter A and letter B. Why? Because the registered nurse should irrigate the nasogastric tube and irrigate the urinary catheter, as these are not in the UAP or UCP scope of practice and job description. So you are left with the two final answer, letter C and letter E. The UAP can measure vital signs and report the findings to the RN. The UAP can measure and record the urine output, although RN would need to make further assessment about the client's status. And for the last number,
Oh, come on.
the registered nurse is assigned to 5 clients for the shift. Which tasks are best delegated to the licensed practical nurse? Select all that apply. This question is an another delegation problem. So by looking at the choices, the routine measurement of a client with a BP of 100/64 does not require the skills of an LPN or LVN. A UAP or UCP could do this instead. So letter C is eliminated. Another, blood administration should not be delegated to an LPN or LVN due to the complication that could arise during the transfusion. Rather, it is within the scope of practice of the RN. So letter E is wrong. While LPN or LVNs are allowed to irrigate nasogastric tubes, the RN should reposition the tube if it is necessary. So letter A is wrong. So the final answer is letter B and letter D. The scope of practice for LPNs or LVNs allows them to irrigate urinary catheters and change dressings on diabetic ulcers. So that is the two final answers. And that's it for today. 10 out of 21 questions of nursing leadership and management. Please watch the next video, which is the continuation of this Q&A of nursing leadership and management. So thank you very much and see you to my next video. Bye-bye!